they will get to me, and we're about, because of this your question, let me let you know that we're about to pass a bill. The bill's in the House now, but I'm still talking with the House Assembly. A bill known as Edo HEMA, that's Edo State Health Regulatory and Monitoring Agency. Currently, we have a department under my ministry, but we want to make it big and give it more powers to be able to prosecute offenders, and then possibly have more power of the purse to move around, procure vehicles, have offices all over the on all the central districts, because it's disturbing that we see a lot of quackery going on. Of course, not just endemic in those states, all over the country. We are actually fighting them, and we've declared a state of emergency in terms of quackery, and our staff have been doing it, although we might not be putting it out there for the media to know, but we've been working towards that.
So, sir, thank you so much. There's this question I would love to ask. It has been bothering me for so long. You know, back here in Europe, like a pregnant woman, majority of us, from the very day you get pregnant till the day you deliver your child, we don't pay dime, we don't pay nothing. They take care of us as if it's their duty. So, but back there in Nigeria, you see a pregnant woman coming to the hospital, the doctor cannot treat. If you don't have a registration card, if you cannot pay for your treatment, you cannot be attended to. Sir, are we looking towards this end to help those that are in need?
Yeah, thank you for your question. We have about 146 centers in the states, primary care center, where we have free treatment for pregnant women currently. About 146 primary care scattered around all the three central districts. So we're already doing it. And of course, we also have some centers, I think like UBTH, Central Hospital, some other few centers where we do comprehensive, we call it CMOC, where even up to cesarean section is free. But you should be able to identify those centers. That might be the challenge.
Thank you very much, sir. I'm here in the UK, and I know a lot of Edo State sons and daughters who are really interested in this. That's why I want to ask this. Do you have plans, sir, to integrate telemedicine or digital health solution? Because I know within this Diaspora agency, there are those state sons and daughters who are pharmacists, who are doctors, who are nurses, who are public health practitioners, dentists, physiotherapists across the healthcare spectrum. Is there any plans to get technology and innovation into our healthcare system, leveraging on the expertise coming from the diaspora?
Yeah, I think Edo State is even the first in the country to start telemedicine in Irua. But we want to expand it, and I know telemedicine might be the only solution to bridge the gap for our Japa syndrome, what we call the brain drain. We are looking into it, and very soon we'll come up with something, but we're actually looking into it, incorporating telemedicine in our primary. I've been getting proposals from Nigerian diaspora. The only challenge and most of the things they are demanding is, for us, is too expensive. I got a proposal from the Association of Nigerian Physicians in the US, and for one telemedicine board, they were telling me something close to almost, close to $1 million or something like that. It's only about 300 million, 209 something million for one telemedicine. When I'm looking at indigenous companies giving us better prices, better options with EMR, less than 25 million. So we are seeing the market open to get the best deal.
Yeah. Thank you very much, sir. Dan.
Honorable Commissioner, let's go deeper into this conversation. What are you doing to ensure that we strengthen the primary health care center in our communities. Because some of these rural dwellers, they don't have access to quality health care service. What are you doing to ensure that we strengthen
Sorry, come
primary
again.
health
I didn't get your question. I
centers?
didn't get your question. What am I doing for what? What am I doing?
What What are you doing to strengthen primary health care centers?
Oh, your
Did
line
you
The
get
is
the
question,
question?
breaking.
yeah, I think
Your
it's
line is
what are you
breaking.
doing? What are you doing to strengthen primary healthcare centers? That's the question.
I just mentioned some of the things that we are doing. First of all, you can't talk about infant mortality or maternal mortality without looking at ultrasound. We've given out 18 ultrasound. We've done train and retrain of our health workers at the primary care level. We are currently renovating 61 primary health care across the three senatorial districts. And in the next 4 to 8 weeks, we will start commissioning them.
Wow, 61 across.
61, yes.
That is very, very heartwarming.
And
Very.
more are coming. We are discussing even with the federal government for support. We are even getting more.
Yeah, I want to quickly ask this question. As somebody with healthcare background as well, what is the synergy at the moment between the Edo State Ministry of Health and the Federal Ministry of Health? We know that we have a very big tertiary health center at the University of Benin Teaching Hospital in Benin City. We have this one belongs to the state. We have the General Hospital in Benin City. We have Otiwoka and quite a number of other hospitals. But what is the relationship? How has it been like? Working with the Federal Ministry of Health to providing healthcare for those state people.
Oh, wonderful. In fact, the Federal Ministry of Health is more like an extension of the State Ministry of Health. Next week or so, I'll be going to Abuja to discuss powering our healthcare, all our hospitals with solar. In fact, all the commissioner of health will be in Abuja next week. 2 weeks from now, they will sponsor our flights, accommodation, and they've been doing it. We've been working hand in hand with the federal government, so we are not working in isolation.
Excellent. Okay. Let's see.
Yes, sir. It's my pleasure having you again, sir. So my
Yes.
question is this: last time I visited home, there was this law that didn't really sweet well with me. You see, here in Europe, if anything happened to anybody on the road or anything happened at all, the first thing is that life matters. They will treat you first. But in Nigeria, they will tell you police report. Are we checking about this in case of accident, in case of shooting or something like this? Why are they not help? The doctors are not happy. You see, a lot of people just meme just because of the doctor's report. Please, sir, throw light to this.
I believe this issue have been addressed. I think that should be a matter of the past. I think currently it's not like that anymore. I think the law have been changed, but it's time to be corrected. I know it used to be like that, but I don't think that's the current trend now. Somebody after the MVT comes and then you're asking for a police report before the person goes to get a police report, the person died. I don't think that I don't think that years before is like that, but I don't think currently that what happens. I to the best of my knowledge. But I'll look into it. Let me write it down. I'll look into it.
So,
And get back to you.
Commissioner, this one is the
Yes.
governor has often said, and I've heard him say this so many times, that there will be no healthcare without the healthcare providers being there. So we have seen the College of Nursing. We have seen the massive support that the state governor, His Excellency Senator Modi Okpebholo, has been giving to our state university, the Ambrose Ali University. So, in your view, how do you see all this, coming to support healthcare provision in our state?
I didn't get your part. I didn't get your part when you talk about
The
I'm
support,
sorry, University. I didn't get your part. I
massive
didn't get that
support that
part.
the governor has been, giving to the school.
Okay,
Yes.
okay. What is my take on that?
Then looking at, how all this goes to improve, at the end of the day, healthcare provision. So the medical school, medical
Of course,
hostel now even
we
being
work in
built.
collaboration
Yes.
with. Yes, we work with IRWA. I work with IRWA. I work with UBTH, and IRWA is centrally located. It's strategically located, and of course, most of the patients there by geography or by geographical location, a lot of them are from Edo State. So it's for us, it's an added advantage for us that we have most of these federal institutions in the state. Not every state have that advantage of having more than about 4 or 5 federal institutions located in one state. Some of them are regional. So it's something that is commendable by the governor, because at the end of the day, it affects our people. If Ira Federal Hospital is straightened out, people will benefit. In fact, currently we have patients there that we are paying their medical bills because they're indigent patients. So we work hand in hand with IRA. Tomorrow we'll be giving out 15 million naira to a patient that has 85% degree bonds. Her parents are not able to pay the bills, and we offset the bill for her. So this is the kind of synergy we have with IRA, and this is why, of course, the governor needs to strengthen that institution.
Yes. Before the next question, there's a comment here from one of our viewers. This one is on Facebook. I think it's on EBS Facebook. It says, "Good evening. A primary healthcare center was built in Ulemo community along Upper Airport Road. Ever since it was built, it has not functioned for the purpose it was built." So, Commissioner, we don't know if you are aware of this. This is from Evans the priest. So these are facilities that can be used. That was a comment from one of our.
I'm not too sure if I really know that, but I know that the primary healthcare center that was built, well furnished, but our people refused to go there because they said it was built on a close to a burial ground or a ritual site. So again, these are some of the challenges we are having. A lot of our people are very traditional, and it's very difficult to convince them. I know that the particular primary center that we built, well furnished, but people refuse. They rather go 100 miles rather than go to that place because they feel that place was built close to a shrine or close to an ancestral land or a burial ground, something like that. I'm not too sure, but it has to do with the culture, which is very
Thank you
difficult to
very
break.
much.
Okay,
So that's why we need more centralization.
a follow-up to what you've just said. Is it ethical and
Yes.
professional for a healthcare provider to outrightly is it professional?
Is it professional or ethical for healthcare provider to do what?
You just said
The line
you
went
have a
off.
well-furnished healthcare center because it's built close to a
Yes.
shrine also, and some of our health providers in the state have refused posting there. Is it ethical?
No. Our people, the community, our people, the Benin people, the Edo people, the Asian people, the Esako people, they refuse to go there.
Okay. Okay.
That's the issue. We've had cases like that. That the place will just be there. Nobody wants to go there because they believe the community was not consulted before that place was built. They now boycott the place. We have more than one or two of those cases.
So secondly,
Yes. So that's why we need sensitization.
are you there?
Yes.
Okay, secondly, we have some that we actually built rightly, built on a better place, in a better location, and yet we don't see medical doctors or nurses there. Some of them are just like healthcare services there, very poor. You come there to access their services, you won't see a medical doctor there, you won't see anybody to talk to. What are we doing to address such shortfall?
Yes. You have to. Yes. One of the ways we can address that is through. One of the ways we can address that is through telemedicine. That's for sure. All over the world, doctors are in short supply. Even in Europe, US, Canada, doctors are in short supply. We have a state we have a state, I don't want to mention that state. They only have 4 doctors in the 2,000 primary health center in the state. So it's difficult to stop globalization. It's difficult to stop migration. We can only try to give incentive to retain our doctors and look for other alternatives like you said, telemedicine to bridge the gap. But to have doctors in all the 550 hospitals in the state, I'm not. That would be a very uh, daunting tax. We have
But
550 hospitals.
sorry, I'm still with you on this. There are allegations that
Yeah.
most of the medical doctors we have in the state, or some of them, as it were, they operate private clinics, and that is stopping them from carrying out their primary functions.
Well, I know doctors may have their private clinic, and nothing wrong with that, but they shouldn't use government time for their private clinic. They can go to their private clinic after their official time. So it's not a secret that they have private clinic. We know they have private clinic, but you don't have absenteeism because they are not going to their private clinic. You can, if you close 4 o'clock, 5 o'clock, you can go to your private clinic, but not going to your private clinic at the official government time. That is where we have issue.
But
Yes, 2 days ago I had a meeting with the Association of Resident Doctors, and they told me one of the things the members agree is not to divert patients from government hospital to their primary hospital, and also not to use government time for their private practice. That is what is clear, even in the Association of Resident Doctors.
well, you've just answered the next question, where you have patients visit some of these government-owned hospitals, and the doctors there will be directing them to their private hospitals. You just answered that. But is that not a breach of contract as a civil servant to run a private clinic when you are fully employed under a government institution? Is that not a breach of contract in civil service?
No, I don't think that's a breach of contract. It can only be a breach of contract if you work 9 to 5 and your private practice is 9 to 5. If you work 9 to 5 and your private practice is 6 to 12 midnight, I don't see any bit of contract there. It's only when you now start diverting patients from the government hospital to your private hospital that's when you have problem with us.
Well, sir, my question is based on what you answered before. I'm standing for the women, the Nigeria, ESA women, Edo women, ESACO, etc. Sir, please, you said that there are some hospitals that they can go and they will benefit from those hospitals. Please, sir, can you mention some of the hospitals? Because I know it will help a lot.
Yes, we have what we call Basic Healthcare Provision Fund. So this fund goes to about 140 something facilities in the state. I don't have them by heart now, but they're all about the state. Maybe after the program, I'll send you a list. Those programs have comprehensive programs. For the pregnant women is free antenatal. We also have the ones they call CMOG. That one even up to cesarean section is free. Then some up to normal delivery, but anything that is complicated, they don't collect more than 10,000 naira. So they are scattered around the state. I will look for the list. I'll ask my director to give me a list. I will send it to you people. Maybe you find a way to spread the list. But it's about 140 something, or if not more than that, across the states.
Thank you, sir.
People who go to primary care, they know. They will tell you. People know. They know the places.
Thank you very much.
But we still have cases okay, Dr. Tony.
No, go ahead.
I wanted to ask a follow-up question, Honorable Commissioner. There are allegations also that patients still pay for basic things like syringe and also pay for gloves and all that. Some even pay as high as 70 to 80,000 for a normal delivery that doesn't have complications within the state. I have personally received calls on that, and I don't know how you're going to.
Well, you should know that in only few countries like Canada, maybe part of Europe, that will have free healthcare. America, you don't have free healthcare. I'm not saying I don't still have free healthcare. You have to pay, but maybe it might be cheaper than private hospital. But the malaria program is supposed to be free in terms of testing and treatment. But that's I'm not sure if they are free. But for the delivery for those 146 centers or so, it's even free, uncomplicated delivery.
Yeah, Commissioner, I just want to quickly chip this in. Recently, there was a reported outbreak of diphtheria, I think in Benin City and Axis. So what is the update on that particular health scare, if I would say?
I read an alarm when there was
Yes.
diphtheria. I didn't keep quiet. I read an alarm and I alerted all the agencies, NCDC, WHO, UNICEF, and I personally went to see the Director General of Nigeria Center for Disease Control to alert them. We got help from them. They were able to give us some DAT, and which we give to UBTH. I personally used my contact to get about 100 vials from Katsina State, ship it down through via Abuja down to Benin Airport. So we'll be doing our own thing. We've also gone to Delta State to get some, just to prepare for any eventuality. So we'll be working hand in hand with UBTH, NCDC, WHO. But currently, I think the trend is not like before. Hopefully, it's going to go down, and I think it's getting better now. Unlike before, where you have the whole world congested, people cannot even admit it anymore because the emergency ward was filled to capacity. But we don't hear that. We don't hear that trend. But I know it's subsiding gradually, maybe because of our massive sensitization on basic hygiene and mass vaccination. We are doing some targeted vaccination for the age group and contact tracing and vaccinating those areas where we had those outbreak. So we've had improvements. Yeah, even maybe I need to say this too. We also
go on, Commissioner.
Just
we also had
before we go.
yes.
Yes, let me talk this.
We also have additional outbreak like dengue fever and yellow fever. In fact, if you go to WHO website, WHO verified Twitter page, you will see where they commended our effort, the Ministry of Health, in conjunction with WHO, to fight an unknown strange illness around Ushelu Market, which we now found to be dengue fever. So WHO actually acknowledged our efforts in the Ministry of Health. I'll send you the link so that you can check it out yourself.
Quickly, let's talk about sanitizing our healthcare system in the state. Most private hospitals have actually turned to a training institute for nurses. And at the end of the day, we find most of them in our communities, in our rural centers, in our rural areas, where they carry out their operation without fear. What are we doing under your watch to stop some of these unproperly trained nurses who end up managing the health of people? Most private hospitals are actually capable of this.
Yes, I've gotten reports of private hospital training auxiliary nurses. In fact, I've seen professors, consultants, senior colleagues who own this facility and also training auxiliary nurses. But I don't know their scope of training. I don't know what their line of duty. But I don't think it's legal. It's only institutions like the nursing school that we have that is certified with the relevant regulatory bodies that are supposed to give license, not a private individual. It's actually wrong, legally wrong. But currently we have so much to contend with, so we'll begin to address our problem one step at a time. We don't want to come and start fighting all of it, everything at the same time. When we get to that part, we'll descend on them. But first thing first, let's strengthen our healthcare system. And the problem with the fact that because we have a lot of brain drain, Japa syndrome. Sometimes it's very difficult to fight these things. In a community where you don't have, where all the nurses, like EBTH, I was told that almost every month they lose about 2 nurses abroad. They go abroad. Even when we call for recruitment, when we are recruiting new nurses and doctors, they only are interested in getting a job because they just need salaries to buy their tickets and relocate. So it's a huge problem for. That's why sometimes in places like India, where you have a lot of cataract surgeries, people even train nurses to do cataract surgeries in countries like India to meet up the demand for the surgery. So sometimes you can train people for a specific purpose, not general. It depends on the scope. If you are training those nurses just to take blood, like phlebotomists, might be okay, but you're not training them to start doing open heart surgeries. So we need to look into that and know their scope of things, then we'll be able to address it. But we'll look into the issue of
Hello.
training or nurses.
Hello.
Yes.
Yes,
Yes. Can hear you.
Commissioner, is like this is a phone call. Yes, we are live on Edo State Diaspora Agency TV. You want to ask the commissioner a question?
Yeah, I'm watching. That's why I want to ask.
Yeah, please. Your name and where you calling from, sir?
My name is Evans. I'm calling from Italy.
Okay, Evans from Italy. Okay, the commissioner is listening. Go ahead, Evans.
Okay. Good evening, Mr. Commissioner. You talked about the centers that run free healthcare for women, but I doubt if most women are aware of these things, because I have assisted in several occasions where women will give birth in government hospitals, and they are asking people to raise funds to discharge them. If these facilities are free, if they know these facilities, I don't think that they will be having this issue of finding it difficult to discharge themselves from hospitals, because these are not complications. These are just women who gave birth, but they don't have money to discharge themselves. So they always solicit for support. So please, can you make this very clear for people to know where to go to access this free medical help? Thank you very much.
Thank you, Evans.
Yeah, thank you. Yeah, thank you for that question. In fact, on Friday we had a stakeholder meeting. I'm the chairman of the State Oversight Committee in terms of the Basic Healthcare Provision Fund, and I realized that Central Hospital located in Edo, one of the most popular hospitals, are not even giving us data for free antenatal and maternal care. So I was even surprised that why we sent with Oredo, given the fact that it's a densely populated part of the state, people are not even using the free facility. You see that they are not aware. Maybe we need to do more of sensitization, because what you said is true. I actually made that complaint on Friday when we're looking at all the states, how many patients they've seen in all the senatorial districts, the regions, and I got that Oredo Hospital, Central Hospital here in Oredo they're not getting patients. So I don't know what could be the reason, but I think the issue is lack of awareness. We'll work on that.
Thank you very much, Commissioner. So I just want to ask you this question, Honorable Commissioner, and this has got to do with health insurance. I know that at those states we have this program in place. So how much are people aware that, because you just mentioned the US, Canada, I live in the UK, I know how it is. Health is quite expensive. It's never free. Even in the UK here, everybody pay national insurance. Everybody pays, and you have a national insurance number. So when it comes to health insurance, how are we galvanizing our people to know that insurance is, like we always say in Benin, I have a debit or insurance. So you don't know what will happen tomorrow. That is insurance. So are people putting something? So how are people taking health insurance, and what is your ministry doing, making sure sensitizing our people to know that you have to put something for the rainy day in case anybody can get sick at any time?
Yeah, thank you very much. We are doing a lot. Let me give you an example. I personally gave out 100 bags of rice, 10 kg each, to Edo Health Insurance Commission when they went on sensitization as a way of incentive. Imagine giving out food, rice, raw rice, 10 kg each when you come to enroll. Just to encourage our people, we have to give bag of rice. That is to show you how far we've gone. And this is a personal donation. Just to encourage our people to enroll in health insurance. Okay, when you come and enroll, come and take a bag of rice. Come and enroll. We are really doing sensitization. But we also need you in diaspora to talk to your people too, to key into insurance. In fact, in the north, one of the commissioners told me they had issues with their religion because I think in Islam, some of them felt insurance was not Islamic enough and all that. So they had to use another method about the Holy Prophet talking about contribution, So if we have to give our people adequate sensitization. Our people in diaspora can call their loved ones in Nigeria and even insure for them as low as 18,000 naira a year for the minimum coverage. So everybody's have to come together to sensitize our people. We are doing our best. We also need you. Maybe when they hear from you, they believe us rather than we from here in Edo State.
Okay.
Sir, we want to thank you for your continued consistencies. You are amazing. Thank you so much, sir.
Thank you very much, madam. Thank you.
Okay, let's talk about the issue of transparency. You have actually spoken well all the while, and following your submission, it's clear that you are actually perfect for this job. But however, health institution got a lot of money. When we hear about budget, most times money allocated or allotted for health is always heavy. But in some cases, Edo people are feeling like they are not part of this amount that is released. Under your watch, are we going to see a transparent Honorable Commissioner for Health who will be bold enough to tell us how much we've received, what we have spent so far, and where we are going to?
Yeah, thank you for your question. You have to understand that the difference between budget and implementation. I can try to say I wish to spend 1 trillion in healthcare. That is a wish. But with internal revenue, be able to get up to 1 trillion, with the federal allocation, be able to get up to 1 trillion, is one thing for you to be able to wish to spend 1 trillion, another thing to have that money from your IGR. So with the little we have, we are doing our best. Like I told you, we've done some of these things. We are renovating 61 primary care health center. Even if it's a World Bank project, that money is loan. We're going to pay. We've given out 18 ultrasound. We've given out.
Commissioner, just finish that.
Yes. So all these things we are doing is money.
You just mentioned. I'm very, very interested in this 61 primary healthcare center. Fantastic. So are these just in Benin City or in those central?
All over the states. In fact, we are going to the second phase now of equipping those facilities with equipment.
Thank you very much. I'll suggest that. Yeah.
We are running up the structural building. We are now going to the second phase of equipping the 61 centers.
Wow, that's good. So, yes. Those state people across the world, our numbers are displayed on the screen. We still have the commissioner with us. He's found time even on a busy. Probably should be relaxing this weekend, or
yeah, we just finished. I just finished a meeting with the resident doctors.
Yes,
before I came into this program.
Meeting went well, so that we don't.
Yeah, it went. Okay. It went well. Went well. Went well.
So we're yeah. It's a.
Yeah, sir. Which hope are you giving to us in diaspora about our people back home over the safety of their heads? Which hope are you giving us?
Well, I put God first in everything I do. My help comes from God, who made heaven and earth. But what I can do is to give our people sensitization campaign, let them know what to do. Like you said, some of these facilities I give free antenatal, most people are not aware. It's my job to put it out there, to do adequate sensitization. It's only God that give life. What we can do, the best thing to do is to prevent the sickness in terms of, for example, the diphtheria, take your vaccination, for the dengue fever and Lassa fever, and what do you call it now? Yellow fever. For the yellow fever and dengue fever, environmental sanitation. Lassa fever vector is rats. Dengue fever and yellow fever vector is mosquito. Clean your environment. Not wait until once in last month of this last week of the month before you clean environment. So my job is to educate our people how to live a healthy lifestyle, diet and exercise. Clean your environment so you don't fall sick because it's even cheaper to prevent sickness.
Yeah, thank you very much. Okay,
my last question.
Yeah.
My last question,
Yes.
sir. A lot of people today are based on
this you are saying. Please, what does it mean? Tell us.
Sir, because of the social media
Yes.
space, you are not expected to say a lot of things. He understand what I mean when I say meme. So what are you going to tell them? Because most of our parents, especially the ones in the remote village, they don't know what is called high blood pressure, low blood pressure, sugar, and all these things. How are we going to tell them?
Yes. That is why I said my job as commissioner is to do adequate sensitization. For example, I did a video and I'll share it to you after this program on World Hypertension Day, in which I featured myself.
Sounds good.
I did, the first lady also did. I have to go pay him to do that video. World Hypertension Day, check your numbers, keep it to yourself, hashtag, I've been doing all that. Also for the diphtheria, I've done videos on diphtheria, I've done videos on dengue fever. All this is a sensitization. And that is the cheapest thing I can do rather than coming down with the sickness and then looking for money to either get health insurance or buy drug medication. So we'll continue to do it and I'll engage more with people, the media and Nigerians in diaspora and other outlets so that our people will be well informed because even the Bible says, my people perish for lack of knowledge.
Yeah.
Yes, sir.
Commissioner, this might be a final for me, but I don't know. The people seems to be out of touch with public health care centers. There seems to be a disconnection. It seems our people don't really believe in our public health facilities. They prefer to patronize private healthcare centers. What are you going to do to restore the faith and the hope of the people in our public healthcare centers?
Maybe what I will do personally is to go to those private, those public hospitals, get admitted there, and then people will see I'm receiving treatment in those public hospitals. Maybe that will give them the confidence. But I don't know why people, and I believe public hospitals are better than private because you have all the specialty. For example, you have the gynecology, you have the surgeon. So public hospitals usually are better than private because the government is able to pay all different specialties under one roof. Rather than a private hospital where you have one or two doctors. So maybe what I can do once in a while, I go there, do a video. But will I need to do a video to say to people that I'm going to public hospital? Maybe that's what they want. I will do it.
Yeah.
So they will say that commissioner they also they go government hospital. Make a come go there. If commissioner can go there, why not go there? So maybe I will do one too. Maybe people say, okay, if I can go, who am I not to?
There's a caller. There's a doctor here is calling. Please, can you ask the commissioners your question and your name and where you're calling from, sir?
Okay, thank you so much, Honorable Commissioner.
Your name and where are you calling from? Tell us that first.
Yep, my name is Dr. Itwa Iriobe. I'm calling from Canada.
Dr. Itwa from Canada. Go ahead.
Canada.
Yeah.
Yeah, thank you so much, Commissioner. I also want to thank Dr. Loretta. She informed me about this, so I just went in like 10 minutes ago. Thank you for what you're doing for those states. I was the immediate past president of CAMPAD. CAMPAD is the Canadian Association of Nigerian Physicians and Dentists. Basically, all the physicians in Canada of Nigerian extraction. I was the president and actually the ESCO. Probably Dr. Loretta will probably have some additional responses. I want to know what is the government really doing in terms of attracting diaspora skill to Edo State. We have a lot of diaspora physicians like myself who are based abroad, I would like to come to Edo State, okay, to do and to contribute something, to the healthcare, welfare of our people. The point I need to mention was the bridge program, which Dr. Lota will be aware of, that Dr. Tunde Alausa did in Abuja just about a few weeks ago, where it's a way to bring, the skills from overseas back to the country, to the medical sector. So I want to know if Edo State is part of that program and what avenue is being done to really attract skills from overseas to come to Edo State to, change, the healthcare delivery system in Edo State. Thank you very much.
Thank you, Dr. Itwa. So, Commissioner, there's another caller on the line, or you just take the two together. Is that okay?
Okay.
Hello, caller. Please, your name and where you calling from, please. Yeah, thanks for holding on. Your name and where are you calling from?
Yeah, I'm calling from Spain, Madrid.
Yeah, from Spain. Your name, sir?
My name is Barry Okito.
Barry Okito. Yeah, go ahead. Ask the commissioner your question, sir.
Yeah, the question I'm going to ask is that when you go to the hospital, the specialist or seller or passenger, I always come to Nigeria. And when you go there, you will see people lining up from 8 o'clock to 12 o'clock, no attendance. Why? The doctors have a private hospital. The doctors will not come until 12 or 1. We are suffering the masses, the poor people. If you don't have money, you cannot go to the private hospital like us that have money. And it is not done. I've been there with other people. Like the commissioner, this commissioner is his father has done well in the state, in the Edo State, in Diaspora. I want my commissioner as a young commissioner. I'm crying for the poor people because our president said, "Let the poor breathe." These doctors that have their own hospitals, a private hospital, we should let them know if they can't do the work for the masses, so that this government will not be blamed. They should face their private hospital and let us employ the new doctors that is coming up, so that these doctors will be there by 8 o'clock and attend to our poor people, our mothers, children, pregnant women. They are suffering there, my brother.
Thank you, sir.
I've been there. I always visit Nigeria.
Thank you.
I always go there.
Thank you.
Let my brother, Siri, Shomole, let him visit there. You will see people unexpectedly. Don't tell them you are coming. You will see your brothers.
Thank you, my brother Barry Okito. Yeah, the commissioner will respond to you and the previous caller from Canada. Thank you, sir. Yeah. So, honorable sir.
Okay, let me respond. For the first caller, thank God we all know that we just did 500 cataract surgeries organized by the DG Diaspora. People came from abroad, came here and gave their own contribution. 500 free cataract surgeries. So we'll be cooperating with people in diaspora. Even last year or so, the Chinese government did for 250 cataract surgeries. We have been dealing with people in diaspora. So you are welcome, and we are very, very accessible. In terms of doctors not coming to work, I'm not aware of that. But we have a telephone number that I will give to you that you can reach me directly. That any concern, you go to Central Hospital 8, 9, 10 o'clock, no doctor, you let me know. But as far as I'm concerned, our doctors come to work. It's only when they are on strike, like currently, but normally they come to work. Yeah. So I can give you a number for you to call to complain.
Yeah, Commissioner, thank you. Maybe you will get that number from you, because this program is live and people can still watch it anytime. It's there on the internet. We are going to be rounding up now because our time, we have just about 3 minutes left on the show. So there's this.
So there are a lot of questions
I've just put a question. This one is from our viewer on Facebook, Irene. He said, which hospital does this health insurance function in Edo Central? So if we have that information, we can put it out. Commissioner, I think this one is for you. Which of the hospital in Edo Central does the health insurance? And then this one is from Joyce Osa. I think it said, can this claim be verified in the Ministry of Health website? So can people get information about the whatever information they want from the Ministry of Health website?
I think she was talking about the free hospital.
And Commissioner, you talked about free hospitals as well. So people need to know all these things.
Yes, I'll send you the details. The 146 or so hospital where you have free antenatal.
Okay, yeah, I think you got another caller here. This will probably be our last call for the day. Hello, sir. Please, your name and where you're calling from.
Yeah, thank you very much, Dr. Amons, and thank you, Commissioner of Health. My name is Dr. Sagi Binosun, and I'm calling from Chicago, Illinois. Mine is not a question; it's just a suggestion or something that you can look into in the future. I work and retire from Chicago Department of Public Health. And there in Edo State, we don't have nothing public health. A lot of things that constitute into illness resonate from public health not being addressed. So starting from the market, fast food industry where people go and eat, the food are not checked and all those stuff. So those are things, if there is a Department of Public Health, those areas can be addressed. My suggestion would be for the state to have a board of health, that is advisory board. There are a lot of us in the diaspora that can volunteer to be in that board. They don't need to be paid salary to give their expertise in the area of community health. So please, those are areas that you can look into and formulate those advisory board that can look into those stuff and write a report, things that can be followed. Because all this fast food, a lot of people are dying from food poisoning, eating food that is so cold and is sent to public. Those are things that inspectors can be inspecting. So I thank you for the great job, and I thank the organizer, Dr. Agbons, and our Honorable DG, Dr. Loretta, for the job you guys are doing. Thank you, sir.
Thank you very much, Dr. Binosun, all the way from Chicago there. So, Commissioner, we are rounding up now.
Yes, please let me make that correct. Let me make that correction, please. Even my job as commissioner, my number one job is public health. My number one job is public health, and I did my second degree at Tulane University, the oldest school of tropical medicine, public health. I was the African student president at Tulane University. We have a department of public health, and we have a very cerebral director of public health. We inspect restaurants and we sanction them when they go against our rules and regulations. So we have a robust public health. In fact, the biggest department under my ministry is public health. So let me just create and then Central Hospital, where we have insurance, is Irwa Specialist Hospital, Wohimi General Hospital, Urumi General Hospital. They are all in Edo Central. To answer your question.
Yeah, thank you.
Sir, please, sir. So, according to what our caller said, here, I live in Greece anyway. I've lived here for a long time. So, like here, when you go to their market, sir, before they go bring meat, sell for us, they will first of all test it. I came to Nigeria, sir. When I came to Nigeria, now me and fly, now they fight for meat. And the place where they will put the meat, sir, you can't even buy it. Sir, they should look towards this place in the market where they sell raw meat.
Yes. Very soon you will see me on TV. We'll be bossing some of those people. I've set up a task force in which I will chair that task force. Some of these abattoirs, some of these markets, they sell contaminated oil. We're trying to get a mobile court where we can sentence them and send them to jail. But the Edo State judge said he cannot do it. We can only designate a court where we can try such cases. So very soon, the next one week or two, I'll personally go there and see how we can gist some of those people. Because we get intelligent report that some of these, even some of the so-called groundnut oil are being adulterated. So maybe we'll have to put some chemicals to make the fruits ripen some of the fruits. Some put it inside sewage to ripen it. So my challenge this why was to be able to prosecute them, but now we're able to get cooperation from the Ministry of Justice. So anywhere from now, we'll start action, and we'll send you some videos so that you can share. Yeah, thank you.
Okay, Honorable Commissioner, back to your earlier statement where you were saying you avail yourself for some kind of medical rounds in our public hospital. Why not suggest that to the government? Let's pass it into law if needed, and have from the His Excellency himself and every public office holder to patronize our public hospitals. That might, in a way, restore the confidence of the people in our health centers. Don't you think so?
Well, you cannot force people to go to government hospital now. I can only do that based on my own as the Commissioner of Health, to go to private hospitals, to go to public hospitals and get treatment. If possible, go with cameras. But I cannot.
You just said you go in there once in a while to access some of their services. That was what you said. That was
Yes. Fortunately, God has blessed me with good health, so I don't really. But I will do it if you want me to do it as commissioner. Well, I might not be able to force commissioner of agric or finance to go and do it. You know my decision, but I can do it to show example and put it out there.
Thank you very much.
Yes, and I will do it. I will send you video very soon. So that you will see it.
Also, one more question. But why is it that our governors, our presidents, our big people, they go to Europe for health care? Why? And we have good facilities. No, that question where a lot of people will want to ask. But why?
My God will never go abroad for healthcare. So I don't have that question.
The commissioner have answered you. Easy, nebo. Yeah, thank you very much. We've gone slightly about 4 minutes beyond our scheduled time. Honorable Commissioner, I want to thank you for finding time to.
Thank you so much.
That's the essence of programs like this. It is often said that when you don't put the right information out there, that is when misconceptions come in. I think we just take this one. This fellow has been trying to talk to you. Let's take this one. Yeah. Hello, sir. Please, your name and where are you calling from? So, yeah, can you reduce the volume of your your device? Yeah. And then your name and where you calling from, sir?
My name is Nicholas Temed. I'm calling from UK.
Okay, Nicholas. Where in the UK, sir?
I'm in Southampton.
Oh, Southampton. Yeah, the island area, breezy. Go ahead.
Yeah, I'm very happy for this program, which I'm watching right now. Because the problem is our people in Nigeria, they're not aware of all this information. So I want to beg the commissioner to please continue to do this program all the time. Maybe once a month or once in 2 months or once in a week, whatever time, so that people can be aware of all this information. Because what I'm hearing now, I've not heard it before, to be honest. So I want the commission to continue to do this kind of program so people can be aware, because awareness is key, to be honest. So they should continue to do this program so that people can key into it and get some information. And if possible, they can give a number which someone can call. Because here in UK, you know how it works. You can go call emergency if you have any health issue, and you have response.
Yeah, thank you very much, my brother.
So Nicholas. They can share to everyone so that I can be able to get in contact with any emergency, because you know how it works in the Western world. When you have any issue, you get a number and you get response. So that is my own side of contribution.
Thank you very much.
Thank you so much.
Yeah, thank you, and for calling back.
Thank you so much.
Thank you so much, my brother. Yeah, so Commissioner, emergency services, ambulance and all that. Yeah. So
before now we had a private company running our emergency services, but now the federal government will be taking over. They've come to inspect our facility and they were very impressed. So they will onboard us very soon. I'm working on them to onboard us. and that will take care of about 5 illnesses like pregnant women, any obstetric emergency, children under 5, snake bite, and 2 other ones. For the first 48 hours, it will be free, both private and government hospital. We are working on it. We are doing our mapping now. Very soon we'll come up with, we'll launch the program.
Thank you very much, Honorable Commissioner.
Yes.
I think we're going to wrap it up here. Thank you so much for your time. And on behalf of the Edo State Diaspora Agency, we want to wish you a very happy birthday. It was yesterday. We know you are still celebrating. But bring our wine and cake. May you not chop alone, Commissioner. we all want to.
I'll bring her come.
So you sabi speak pidgin English like this? Yeah, pidgin English is sweet for your mouth too.
You see, I said
I know we bring her come.
You're speaking English.
I understand, madam. Now, where they say peme. You know understand peme. Me, I know peme.
You understand the.
I know peme.
Your pidgin English smooth too. No, say now our audience would they ask for no be say no be na Benia grow. We all know the levels. So happy birthday, sir! And
thank you.
Social media does not accept.
Social media, you are right. Yeah. Even in spelling some words on social media, you have to use some style so that they don't close you down.
You don't understand.
Yes. And please,
thank you, sir.
Yes.
Before we go, we talked about giving out a number that can be reachable because of our
090
yes
090 163 5001.
Okay, so we're going to put it on the chat on EBS TV, YouTube, Loud Media, Facebook, Edo State Diaspora Agency Facebook, and all social media handles, and even on Oberland TV, YouTube.
Yes.
So that those that will watch this program at a later time, they will see it. Commissioner, we are very happy having you here today.
Thank you, sir.
We are like Oliver Twist on this Edo State Diaspora TV. We'll call you again, so hope you will
come.
No
problem. No problem. I'll call my wine that time.
You know. Thank you so much. But before you go, and as we always do, on behalf of myself, Dr. Tony Agbonsle here in the UK, my lovely sister Isi Negbunebo in Greece, and my brother right there from EPS studio in Aduawa in Benin City, Daniel Praise Osedebame, who are going to just sign off with our very sweet Edo State anthem. Please let us enjoy as we take our Edo State anthem. For all those that called in today, Dr. Itwa from Canada, our brother Evans from Italy, Barry Okito from Spain, Dr. Egbinosu from Chicago in the United States. Make I use American accents more for that. And our brother Nicholas from Southampton here in England. We thank you all so much. All those that drop chats on YouTube, on Facebook, we appreciate you all. Let's keep the conversation going. Like I was trying to say, when people are not informed, they are deformed. But when people are informed, they are transformed. That is why we have this program. And like you brought a lot of government officials here, and we'll be bringing Edo State sons and daughters in the diaspora to this program as well, so that we need to be talking, we need to be sharing our positive narrative. It's not about just talking about saga all the time on social media. So this is the place to be. So if you are watching these programs, please share. The more you share, the more the algorithms of Facebook and YouTube we share this thing around, and more people will see it, and those state people worldwide will see it. Together, we want to build a better Edo has risen. So let's join hands together to make it work. And as it is often said, teamwork makes the dream work. So we take the Edo State anthem as we sign off until we see you again next week.
Thank you so much. Bye-bye.
Sons and daughters of the land. The king of the city is marching. Stand up high to the pride of the land. The founding fathers have labored, and our time to serve is now. The glory of the new Edo nation will forever be our pride. Beautiful Edo, glorious Edo, you're the heartbeats of singing,
Alpha Americana, how you doing?
you're the land people
Yeah, thank you. On our next week, man.
our treasures are found in all nations, and
So,
our greatness is second to
thank you.
none. Our history forever shall be written. How our kings have endured all time.
Forget your brother now.
Our people culture our hearts beat for the land.
You forget your brother.
Culture, stories,
That's right, so,
heroes,
I said, please don't cry for my mom. My mom don't
beautiful and glorious and you're the
I said, my mom can't don't
please don't cream.
put my knee up on my own girl.
Yeah, I don't put money. I put money up. I leave that grass now.
Unite and stand with each other. Forgive and let it go. Together we can stand, come what may. And the future lies in us. Teach our children to teach their children what our